ನಮ್ಮ ಹೆಸರು ಚಿತ್ರ ಅಂತ ಹೇಳಿ, ತಂದೆ ಹೆಸರು ವೆಂಕಟೇಶಪ್ಪ, ಊರು ಬಂದು ಮನಗೊಂಡಳ್ಳಿ. ಈಗ ಲೈಟಾಗಿ ಎದೆ ನೋವು ಕಾಣಿಸ್ಕೊಂತು 12ನೇ ತಾರೀಕು. ಹಂಗೆ RV ಹಾಸ್ಪಿಟಲ್ಗೆ ತಗೊಂಬಂದ್ರಿ. ಮತ್ತೀಗ ಕಾರ್ತಿಕ್ ಸರ್ ತುಂಬಾ ರೆಸ್ಪಾನ್ಸ್ ತಗೊಂಡು ಹಂಗೆ ತಕ್ಷಣ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟರು. ಮತ್ತೆ ತುಂಬಾ 13 ಸಲ ಕಾರ್ಡಿಯಾಲಜಿ ಕಾಣಿಸ್ಕೊಂಡ್ರು. ಮತ್ತೆ ಏನು ಇದು ಮಾಡಕ್ಕೆ ಆಗ್ಲಿಲ್ಲ. ನಾವು ತುಂಬಾ ಭಯ ಬಿತ್ತಿತ್ತು. ಆದ್ರೂ ಕಾರ್ತಿಕ್ ಸರ್ ತುಂಬಾ ಧೈರ್ಯ ಹೇಳಿ ತುಂಬಾ ರೆಸ್ಪಾನ್ಸ್ ತಗೊಂಡು ಟ್ರೀಟ್ ಮಾಡಿ 1 ವಾರ ಇದು ಮಾಡಿದ್ರು. ಉಳಿಯೋ ಮೂಮೆಂಟೇ ಇರ್ಲಿಲ್ಲ. ನೀನು ಉಳಿಯೋದ್ ಗ್ಯಾರಂಟಿನೇ ಇಲ್ಲ ಅಂತ ನಾವು ಎಲ್ಲ ಧೈರ್ಯ ಇಟ್ಕೊಂಡು ಇದು ಮಾಡಿದ್ವಿ. ಆದ್ರೂ ಸರ್ ತುಂಬಾನೇ ಕೇರ್ ತಗೊಂಡು ಮಾಡಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟು ಜೀವ ಉಳಿಸಿದ್ರು. ತುಂಬಾ ಧನ್ಯವಾದಗಳು. ಸಾಯ ತನಕ ಋಣಿಯಾಗಿರ್ತೀವಿ. ಕಾರ್ತಿಕ್ ಸರ್ ತುಂಬಾ ಕೃತಜ್ಞತೆಗಳು. RV ಹಾಸ್ಪಿಟಲ್ ತುಂಬಾನೇ ಇದು ಮಾಡ್ತೀವಿ.
Hi, I'm Dr. R.S. Karthik. I'm a concerned interventional cardiologist working in Aster RV Hospital, Bangalore. This was a very interesting case of elderly male coming in with what is called as acute heart attack. Heart attack is an event where one of your arteries of the heart would have blocked off completely. Means to say usually 100% or maybe 99%. So this is a life-threatening situation. Heart attacks are always supposed to be dealt very urgently, as we have always learnt, where we understand that people have died because of heart attack, they kind of reach late, all of these problems will be there. So they have to reach the hospital at the earliest. What kind of hospital? Where they can do something called as primary angioplasty. Primary angioplasty has to be done in something called as cath lab. This is a specialized place or OT where we do this procedure, where we unblock the artery, and if at all there is a clot, we take it out. If there is a requirement for the stent, we put a stent and come out, so that the artery is not going to get blocked again. The primary angioplasties are something which we expertise in here, and that's one of our specialities in our hospital, where we have 2 cath labs specifically for primary angioplasties, where if one is occupied, we can do that in the other lab. This is a urgent procedure. So we have something called as activation of cath lab. If a patient reaches our hospital, the emergency ward, we activate cath lab, and people who are supposed to do an angioplasty reach the hospital within 15 minutes, so that the patient gets early attention and the best care possible. Primary angioplasty, we require doctor to do it. Second, we require anesthesia doctor so as to be on standby if any exigencies occur. An anesthesia technician will be there, a cath lab technician will be there, preferably 2, and at least 3 nurses who are trained in doing this. And we have all these things in place, and that's why we will be able to do a good job at it. In this case, he reached our hospital in time. He was referred from a outside hospital where they had called us before to tell that such and such case is coming, and we were prepared for it. As soon as he reached, the cath lab was activated, everybody was in place in 15 minutes, and we took him up for a primary angioplasty. During the procedure, unfortunately, he had cardiac arrest multiple times. Usually, if this occurs outside the hospital, the chances of him surviving is extremely low to nil. But because it was in the cath lab, we could kind of make it out, and we could act upon early. During the angioplasty, when we were kind of trying to do this procedure, he had 13 cardiac arrests, which is very rare. He had 13 cardiac arrests, and we had to kind of shock him into the rhythm 13 times. So technically the heart was stopped for 13 times, and we had to restart the heart, and we were able to complete the procedure successfully, and he was brought in alive from the cath lab, and he had some time to recover in the hospital, and he went home very happily. So this was one of those rare events where we could save a patient in spite of all this, and he went home on his own. He walked home. So one of the most pleasurable experiences, where you are so much happy that okay, this happened, and this happened with us, and we are very happy to see him, and he was and the family was so happy that they could see him again in spite of all these things. See, this is one of events, agreed, but people have to understand why are we projecting this is basically, people have to understand that the heart attacks can be deadly. Why? Statistics say that 30% of the heart attacks people can die. So that's why to reach the hospital which is equipped to deal with it early is very important for general public. Heart attacks are not simple events. Heart attacks are not your garden variety diseases. These are emergencies which should be handled well so that we can give the best possible outcome to the patients, and that's what happened in this case. And unfortunately, in spite of this, being Bangalore, where there are so many places where cath labs are there and cardiologists are there, we still lose patients. That is something which is very disheartening. My message to general public will be, if you are suspecting or has been diagnosed as a heart attack, please reach a facility, a hospital which can deal with heart attacks by doing something called as primary angioplasty at the earliest, so that we can take care of you better and you have the best chance of survival and getting out with a good quality of life. So please don't ignore a heart attack anyway, because it can be fatal. Thank you.